So how can you evaluate and manage fatigue when you're receiving immunotherapy, and how do you work with your oncology team to assist you in that management? What will they be doing to help? So one of the key things for patients with kidney cancer is to make sure you're getting adequate hydration. You've already had, in most cases, surgery, and so you've had either a partial or radical nephrectomy. That is key to make sure you're maintaining adequate hydration, and that's about 60 ounces of fluid a day. You also want to minimize the coffee and the caffeine intake, but it's important to maintain hydration throughout the day. It's also important, if you have fatigue, to exercise. And it seems counterintuitive, but there's a lot of clinical trial and research data that supports the exercise impact to manage and minimize fatigue. So even if you're tired, go for a short walk. You will feel better. You don't have to do the eight holes on the golf course. Take a golf cart, but get out and do things. Frequent small walks. You will find that will help your fatigue, along with frequent small meals, snacks, and fluids. It's important that you let your oncology team, your oncology nurse or nurse practitioner or physician know that you're really having some struggles with fatigue or tiredness, that you lack energy. Whatever the term you use to describe that, you need to communicate that with your oncology team. They may do blood work. That blood work may include thyroid function testing to make sure that you've not experienced hypothyroidism from the immunotherapy. Unique to kidney cancer patients is that you may have been on one of the VEGF therapies prior to the immunotherapy. So you may have been previously treated with drugs like sunitinib, pazopanib, or axitinib, or others which cause hypothyroidism. That can potentially worsen with immunotherapy, and your oncology team will monitor your thyroid function and or do adrenal testing to see if there is a way that they can manage that to minimize the fatigue. It may very well be appropriate to hold a dose or an infusion of the immunotherapy. Number one, to evaluate and monitor those lab tests, but also to see if just simply a treatment break will help with management of the fatigue. Cancer patients are at risk if you have kidney cancer and had a radical nephrectomy. You may have had the adrenal gland taken at the same time with that primary surgery. So your other adrenal gland is functioning, but you may find that you have developed some adrenal insufficiency, which can very easily be managed by your oncology team. And on occasion, we will refer patients with either hypothyroidism or adrenal insufficiency to an endocrinologist for expert management. And that's a very appropriate thing for your oncology team to do. We collaborate in order to really make sure that we're treating patients as most appropriate.